Welcome back to Rural Health News, this segment of Rural Health Today, where we fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. First, what's most urgent. At the end of March, Health and Human Services, alongside CMS, announced a new healthcare advisory committee and its membership. The committee is tasked with making recommendations to HHS and CMS in modernizing Medicare, Medicaid, and marketplace insurance plans, reducing administrative burden, improving chronic disease prevention, strengthening Medicare Advantage, enhancing data and quality measures, and improving care for America's vulnerable populations. Out of 400 nominees, 18 were selected to serve 2-year terms, and among these 18 are 4 healthcare executives, 5 physicians, and 4 policy analysts. While the committee's goals sound very noble, several concerns prevent healthcare leaders from feeling too optimistic about its influence. Under the control of HHS, experts warn policies emerging from this committee will be strictly limited to advancing the Make America Healthy Again movement. While several of the committee members have had a hand in rural health, there are still concerns that rural health care won't be represented to the extent needed. We'll be watching updates from this committee closely moving forward. On to the damage report. Rural hospitals continue to face disproportionate workforce shortages in almost every specialty, especially mental health, primary care, and OB. This makes it even more difficult for understaffed, underfunded healthcare facilities to care for their rural population, which usually have higher rates of chronic illness and lower incomes. With urban hospitals offering competitive bonuses, better access to housing, and a thriving economic setting, it's no great mystery why healthcare workers are favoring these opportunities. Lower recruitment rates inevitably result in high turnover rates for rural hospitals, as the staffing shortages add to workforce burnout and lack of adequate funding leads to fewer resources. Many states are putting workforce development at the top of their list for the rural health transformation funding, but to build a rural workforce with long-term sustainability, it will take much more significant investment to equip rural hospitals to stay competitive as employers. Attracting talent to the rural workforce starts before students even graduate with their nursing, medical, or other healthcare degree. From entry-level positions to board-certified surgeons, each career pathway merits awareness and education starting sooner in students' education. Some hospitals and schools partner to present these opportunities as career fairs or volunteer activities, but rural health will need more support if we ever hope to close the workforce gap. And now for today's success story. Birthing units are often one of the first service lines to close when a rural hospital experiences financial strain or staffing shortages. This was the case in 2023 when Advent Health Ottawa closed its family birthplace in rural Kansas, turning the entire county into a maternity care desert. As of August 2025, however, Advent Health reopened their birthing center to address their community's desperate need for local maternity care. This was possible in part thanks to Advent Health's new rural health clinic structure, which aims to restore vital healthcare services to their rural county. Birthing centers are vital to the well-being of every community, no matter how small, and sustaining them makes an incredible difference for the families each rural hospital serves. Thank you for our sources to today's episode: Becker's Hospital Review, the Keckley Report, The Hill, Westat, Rural Health Information Hub, and the Heckner Report.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.